Hey, excellent. Whew. Hello, everyone, and welcome to another Envision Money Making Sense. Woo! We're coming to you in Chicago and other places around the world on a fine, dreary day of October the 26th. Normally, we give a little more time, maybe like 2-3 minutes to see if everybody is going to show up. But today, we have an incredible guest speaker, Melinda Caughill, who is going to be bringing us all a wonderful bit of education on Medicare and medical information for all the confusion and clearing away some of that obfuscation and fog. So for the interest of time and making sure that we get out of here at the under the hour mark, I'm going to be handing it off straight to our lovely James Brewer, who's going to be walking us in an introduction. Please feel free to throw any of your questions into the Q&A, and we will be answering those at the end. And as always, there is a recording of this that will be going up on our website, and everybody who registered but did not attend, you'll also be getting an email with the recording.
Thanks, JD. I am James Brewer. I'm the founder, CEO of Envision Wealth Planning. I'm so excited today to have one of my good friends, Melinda Caughill, on the webinar with us today. I've heard her speak, and I've never seen anyone this energized over what someone could learn about Medicare, especially the gotchas. And you don't want a gotcha because it's quite costly. That you see my background. I'll let Melinda tell you what she feels she'd like to say on top of I-65 and her connection to Forbes as well. And I'm going to pass it on as soon as I show you the exciting slide that shows about the disclosures. Basically, what we're telling you today is for information purposes. We're not giving any recommendations. Really, nothing has to do with investments, but I'm a registered investment advisor, so I'm required to put up disclosures. And on the replay, you can read it all. And my friend Melinda.
Wow. Oh, do I get to take it from here now?
You do. So I'm going to stop my share and give it to you.
Okay. All right. Continue. Okay. Ooh, wait, hold on, people. There she goes. And now she's going to push this button. And then, so you see my screen? Look good? And thumbs up, JB. Do you see my screen?
It's looking good.
Okay, awesome. Now, first things first, I have to do this for everybody. So you know this lovely gentleman who just introduced me as James Brewer. No, we're not going there. So we're going to do what I always do whenever I see James Brewer. I go up to him, straight into his face, and I go, so anyways, I would love it if y'all do that when you see James Brewer next time. Just get in his face and JB him and be epic. He'll love it. Anyways, let's get on to the point. So the reason I'm here today is to talk to you about Medicare's annual open enrollment period. I'm going to give you the rundown of what you need to know about open enrollment. Yes, this is me. You've already seen that cheesy photo a fair amount of times. I am the co-founder and considered a Medicare expert and Medicare educator across the country. My job is not to sell insurance. I don't sell insurance. I work like an attorney or an accountant. I work directly for my clients, not insurance companies. So I have the privilege of being able to tell things exactly as they are. I don't have to get permission from an insurance company to give you the full truth. Woohoo! So what I want to do in order to help you understand the important pieces of Medicare's annual open enrollment period is to actually back us up. Whoop, whoop, whoop. That's where backing up the truck. All right, so I'm going to teach you the steps of Medicare enrollment. In this country, we all believe that when we hear about Medicare and Medicare enrollment, we believe that Medicare is basically a 3-step process, with those steps being choose your plan. So I'm looking at getting enrolled in Medicare. What do I need to do? I have to pick plans, United Healthcare, Humana, Aetna. Choose my plans. Then I get enrolled in Medicare. I get my Medicare card in the mail, and then I sign up for the plans that I had initially chosen. That's what our whole country almost believes Medicare enrollment is all about. And it's really not. Medicare enrollment is actually 6 steps, and I would argue all day long that the 3 steps most people have no clue about are the 3 most crucial steps of the enrollment process. So please indulge me while I teach you all 6 steps of the Medicare enrollment process. This will be critical in just a minute. Okay, so step 1 of the Medicare enrollment process is timing. Do you enroll in Medicare right away at age 65, or do you delay? I know for a lot of people, that's a shocker. I thought everybody had to enroll in Medicare as soon as they turned 65. I thought everybody had to enroll in at least Medicare Part A. I don't know, whatever the myth is. So first, the golden rule of Medicare. Ready? The golden rule of Medicare. The only thing in Medicare that is true for everyone is nothing in Medicare is true for everyone. Got that? The only thing in Medicare that is true for everyone is nothing in Medicare is true for everyone. So whenever you hear one of those truisms, everybody has to fill in the blank. It doesn't matter what is in the fill in the blank part, because you know it's not true. Any sentence about Medicare that starts, everybody has to, is not true. All right. Okay. So step 1 is timing. And the answer of whether you enroll or delay depends on everybody's unique situation. If you determine that you need to get fully enrolled in Medicare, step 2 is still not picking specific plans. Step 2 is determining your Medicare path. And by path, technically what I'm talking about is the type of coverage that is best for your unique needs. Now, this is why I'm teaching you the 6 steps, because people don't realize that the path decision you initially choose when you enroll in Medicare can become a permanent, lifelong decision. You may never be able to change the path you've chosen later in life. Got that? So the path options that everybody has is it original Medicare with a Medigap policy or Medicare Advantage. But some clients have retiree coverage paths, TRICARE military coverage paths, federal employee health benefits. Choosing your path is critical because you may not be able to change it later in life. Cool. Timing and then path. Once we know those, then we can go ahead and choose specific plans. So if there's one lesson to take from learning the steps of Medicare enrollment, it's that Medicare is not all about picking United Healthcare, Humana, Aetna plans. That's what insurance companies want you to think, because that's where they make money. That's where they sell things. It's not all about that. Once you know and you've completed the first 3 steps, then you start the process to get enrolled in Medicare, get your Medicare card, then you sign up for the specific plans you chose in step 3. And then congratulations, you will be enrolled in Medicare. That's 5 steps. I told you there were 6. So what's up, Melinda? Well, what's up is the fact that you are never done re-enrolling in Medicare. You need to be reviewing your coverage each and every year for the rest of your life. Putting Medicare on autopilot is a very, very costly mistake for many, many people. So those are the 6 steps. Now, for open enrollment, I am going to go back to PATH, Medicare PATH, and talk more about this, because inevitably during open enrollment, everybody's getting inundated with commercials and mail pieces that talk about extra free benefits and $0 in monthly premiums. So if you happen to have a type of Medicare coverage where you're paying monthly premiums and don't have a free gift card to CVS once a quarter, what the heck? Well, I want those extra freebies too. So this is what I hear. My friends are telling me I pay way too much for Medicare and I don't have all the extra free benefits that they do. I think I made a mistake. All right, this is what a lot of people think because we don't do path selection strategically in this country. We just jump right into picking specific plans. We don't understand the differences between original Medicare with a Medigap policy and Medicare Advantage. So better late than never, or better now than never. I'm going to teach you the differences between these two Medicare paths because it is crucial to know during open enrollment. So Medicare likes to say it has 4 parts of coverage: Part A, Part B, Part C, and Part D. Blech, ugh, yucky, poopy, yucky. In my world, C is for confusing. Okay, C is for confusing. C is not a basic part of Medicare coverage. Part C is a repackaging of Part A, Part B, and Part D. So we just throw it out. Throw it out. Medicare has 3 basic parts to coverage. Part A, hospital insurance, Part B, medical insurance, and Part D for drugs. And then different paths to walk down. You will get hospital, medical, and drug coverage on those different paths, but the experience that you have getting healthcare coverage will be very different depending on which path you choose. Okay, so let's first Part A, hospital insurance, $0 for premiums because you've prepaid it. Medicare Part A is premium free for those people who have worked and paid taxes or have a spouse who has for at least 10 years. It also covers skilled nursing facility stays, skilled home health care services. Skilled. Skilled is not long-term care. Medicare does not cover a penny of long-term care. All right, so that's Part A, hospital insurance. Part B is medical insurance. So this is the part of Medicare that allows you to see doctors, specialists, have labs, surgeries, diagnostics, preventative services. This part of Medicare in 2024 is increasing about $10 a month to $174.70 a month per person. If you are considered a higher income person, congratulations, you'll pay more for Medicare. That's Part B. And then Part D, D for drugs. So you don't get drug plans from the government. There is no such thing as a government provided Part D drug plan. All drug plans are provided by private insurance companies, and they only help to cover the cost of prescription medications. Expect copays. Now, there we are. Now, when you're making the decision, hey, I'm enrolling in Medicare, which path do I go down? Essentially, that's you in the car, little red car, toot toot. You have to decide which path you will head down. So let's talk about how these work because they are very different. The path of original Medicare, the first thing we do is we put the Capitol building in the background. The government is in charge on this path. This is the government's Medicare. When you head down this path, the government is in charge. They are making the rules, administering the program. One of the biggest benefits of heading down this path is the fact that you can see any provider who accepts Medicare. Doesn't matter if you live in Illinois, but you're traveling to Florida or Arizona or California or Hawaii. You can go to see any provider who accepts Medicare, go to any hospital that accepts Medicare, Mayo Clinic, Cleveland Clinic, Johns Hopkins, Northwestern, whatever. All options are open. Now, if you choose this path, you get started by enrolling in Medicare Part A and Part B. By law, you could stop here and say, I'm done, I'm fully enrolled. Please don't do that because Part A and Part B have a lot of costs associated with them when this is the only coverage you have, essentially a $1,600 per hospitalization deductible. 20% of every doctor bill, every specialist bill, every lab comes out of your pocket. A and B have no spending limit when this is the only coverage you have. Can you say ouch? I can say ouch. So Comprehensive coverage is the goal. To get comprehensive coverage, you also add a Medigap policy and a Part D prescription drug plan, both provided by private insurance companies and very often different insurance companies. No need to get Medigap and drug plan from the same insurance provider, not required. Once you have that Medigap policy in place, poof goes the extra costs you would have seen if you just had Part A and Part B coverage. So this is the closest thing to Cadillac coverage that you can get on Medicare, period, end of story. Little bit more information about a Medigap. Medigap supplement, Medigap. They are exactly the same thing. They are a component of the path of original Medicare. Do not fall victim to the insurance companies referring to Medicare Advantage as a supplemental coverage or a supplemental policy. No, it's not. It's a totally different way to get Medicare, and it has nothing to do with an actual Medicare supplement. So two totally different things. The federal government took Medigap policies and standardized them into different levels of coverage. Of course, they refer to these different levels by more letters. I know, super fun. So you can have a Medicare Part A, a Part B, and a Part D, and then have a Plan G, a Plan N, a Plan K. But, and this is a big deal, in order to get, and in many, many cases, change Medigap policies without medical underwriting, you have to have a guaranteed issue right. Melinda, what the heck is that? I'm so glad you asked. So a guaranteed issue right is essentially a period of time, 6 months after a person is enrolled, for the first 6 months after a person is enrolled in Medicare Part B, they have a guaranteed issue right. During this 6 months, insurance companies cannot ask you about your health, cannot charge you more, and cannot deny you coverage based on your health. That's for 6 months. That doesn't last long. After that 6 months, they can ask you about your health, they can charge you more, and they can deny you coverage altogether based on your health. So in the future, you may not be able to get or change Medigap policies depending on state and your health. Yeah, that's fun. So all in this path, when you have Part A, Part B, a Medigap policy, and a Part D drug plan, is a very budgeted, predictable, and free, not cost-free, but free as in freedom. A very free approach to healthcare. If your doctor says you need something and Medicare covers it, you get it. No insurance company can say no. You can go to any doctor. You can go to any hospital that accepts Medicare. This is the spending chart for 2024 on the path of original Medicare. You're looking at $174.70 for Part B, average Medigap policy Plan G. Plan G is good. You got that? Plan G is good. If you can't afford a Medigap policy Plan G, try Plan N next. Okay, there we go. So average Medigap policy Plan G, $183 a month. No Medigap policy covers the Part B annual deductible. That's $240 one time. Once you spend that, then you're done. The Part D prescription drug plan, national average about $33. So all in, you're looking at about $400 a month. $400 a month, and then no additional out-of-pocket costs for healthcare services. You could get cancer, be in a hospital for 3 weeks, and not see another bill. That's how this works. All right, now, the other path. And again, this is super critical. And why I'm telling you all of this is because of open enrollment. So promise we'll get there. So the path of Medicare Advantage is very different than the path of original Medicare. In fact, you could say it's the mirror opposite of the path of original Medicare. On this path, the first distinct difference is there's no Capitol building in the background. Now there's a corporate building. When you choose Medicare Advantage, you do not have Medicare anymore. Let me say that again. When you choose Medicare Advantage, you don't have Medicare provided by the government anymore. You've essentially walked to a returns counter and said, hi, I don't really want this Medicare Part A and Part B. Here, in exchange, let me take this insurance company's version of Medicare. All the rules in Medicare.gov, all of the things in the Medicare and U book don't apply to you on this path. The insurance companies are in charge. They make the rules. So you have to follow their rules. You really don't need to carry around your red, white, and blue Medicare card because it won't get you anything. You have to carry around a Medicare Advantage insurance card. So yes, when you choose Medicare Advantage, you do not have Medicare. Got it? Cool. All right. Medicare Advantage policies, just to make things more confusing, still require that you be enrolled in Medicare Part A and Part B. Why? Well, because you have to be enrolled in Medicare Part A and Part B for a financial transaction to happen. There is a certain amount of money for each person who's worked and paid taxes for at least 10 years in the Medicare Part A trust fund. So there's money in the Medicare Part A trust fund with my name on it, Melinda Caughill. I would have to be enrolled in Part A for that amount of money to be transferred to the insurance company to take care of me. And I am paying monthly premiums each month, so those monies have to be transferred to the insurance company. Then the goal of the insurance company is to keep as much money as they can. It's just the goal. All right, so you Part A and Part B services, you don't follow the rules of the government, you follow the rules of the insurance company to get those services. The plans that you get through this path usually roll in drug coverage. Same drug coverage, regardless of whether you are on original Medicare or on Medicare Advantage. Same rules, same copays, same structures. What makes this path super attractive during open enrollment is, Joe Namath, $0 in monthly premiums, free dental coverage, free gym membership. Call the number on the screen today. Thank you very much, Joe. So please notice $0 in monthly premiums. That is 5 words. Do you think the insurance companies would use 5 words if they could use just 1, free? No. If they could say free, 1 word, they would. But they can't, and they don't. So they have to say $0 in monthly premiums, which takes 5 times as long. Because these plans are not free. Okay? So let's just go with that. Now, those extra benefits that people get really excited about, free dental, free eyeglasses, free hearing aids. Let's talk about those. So yes, more than 90% of Medicare Advantage plans now include over-the-counter gift cards, dental, vision, hearing, telehealth, fitness benefits. But I absolutely guarantee you that JB, for example, your definition of free dental is not going to be the insurance company's definition of free dental. Guarantee it. I have seen this so many times. People call me up and say, Melinda, I have free dental, but I just got a bill for $3,000. What went wrong? Can you help me fix it? No, I can't. In order to understand free dental, you first have to understand something called plan limits. Plan limits put a cap, a ceiling on the total benefit you will get in any given year. When it comes to free dental, 60% of Medicare Advantage plans in this country cap the total benefit per year at less than $1,000. So people think I'll get free crowns and bridges and extractions. And I say, haha, that's funny. You won't even get 1 single free crown. They're typically $1,500. Maybe you'll get 2 cleanings and a series of x-rays. That's not nothing, but it's certainly not what people think it is. Those free eyeglasses, I want to know where these people shop, because the last time I got eyeglasses, they were $450. The national vision plan limit in Medicare Advantage is $160. I'd still be walking into walls. It's just how it goes. So the reason I'm bringing this up, the reason that I'm harping on this so much is because studies have shown that people really, those with free dental benefits, really on average only save about $226 a year over people who have no free benefits. $226 is not what people think when they think free dental. So what's the point? The point is, don't take your eye off the ball. The reason any of us have health insurance are for the big things, the major medical things: cancers, strokes, heart attacks, Alzheimer's, serious car accidents. The things we know will bankrupt us if we don't have health insurance that covers them. You need to ask about these things and focus on these things before we talk about free gym memberships or hearing aids or $226 in dental. Okay, so Medicare Advantage gives you a package of coverage. That package comes from the insurance companies. To use this package of coverage, you have to follow the insurance company's rules. Rule number 1, you have to see providers in a network. If you go outside of the network, you may have no coverage. No problem, Melinda. I will just get a Medicare Advantage plan with PPO coverage, out-of-network coverage. I have out-of-network coverage. I don't have to worry about that. Oh, but you do. This is a trend we've been seeing for 3 years coming out of Florida, and unfortunately, I get to report now it's everywhere now. So now it doesn't matter if you have out-of-network coverage. There is no requirement that a hospital or a doctor that is out of network has to take your coverage. So there's a big, in Southern California right now, there's a huge medical practice called Scripps. Scripps has now said, nope, we will not take anybody with Medicare Advantage. This affects 35,000 seniors right now. 35,000 seniors now go, well, all my doctors are in Scripps. What do I do? I don't know. And this, you'll see this in Georgia, in Illinois, in Ohio, in Maine. It's basically going everywhere now. So just because you have out-of-network coverage does not mean that you can go anywhere or see anybody you want. Okay. Rule number 2. You are subject to prior authorization rules. So what this means is the doctor may say, hey, JB, you need knee surgery. Your knee just looks terrible. And you're like, oh, gee, doc, I don't want to, but okay, let's schedule it. JB, I made you sound really ridiculous. Sorry. So, yeah.
My knee is hurt.
There you go. Well, JB, before you get knee surgery, if you were on a Medicare Advantage plan, it doesn't really matter what your doctor says you need. You have to get permission from an insurance company before you move ahead with what the doctor says you need. If the insurance company says they don't think you need it, but you go ahead with that service anyway, you will pay 100% of the bill, whether that bill's $100 or $100,000. That entire bill is yours to pay because you didn't follow the rules. Let's be honest. Prior authorization is everywhere in Medicare Advantage. Everywhere. Basically, the rule of thumb is if you want to do anything or need to do anything other than see your primary care physician, insurance companies can get prior authorization. If the insurance company says they don't, they have 14 days to say yes or no. Imagine you're waiting around for chemotherapy. 14 days for chemotherapy to start, 14 days for a heart attack to start. Now, there are some twists and turns in those rules, but if they deny it, you can appeal it, but then you've got more time that you're waiting around. So anyway, prior authorization is something to definitely keep an eye on. Last rule, you are subject to paying deductibles and copays whenever you use healthcare services up to the plan's out-of-pocket spending limit. And since I put this chart together, I now know what those out-of-pocket spending limits will be in 2024. They're increasing to $8,850 in network and $13,300 in and out of network. That's not chump change. Those are significant out-of-pocket spending limits, so beware. So all in, this path fully built out is the mirror opposite of original Medicare with a Medigap policy. This path, you will pay no monthly premiums for the Medicare Advantage policy, but you will pay every time you use healthcare services. And if you don't follow the rules, all bets are off. The spending limits only apply when you're following the rules. So this is the spending chart on Medicare Advantage. It's a range, but only a person with a functioning crystal ball can give you any certainty of what you will actually pay in a given year. The best I can tell you is the lowest amount you will pay if you never see doctors or have anything happen to you. I can't tell you how much you'll actually pay. It will depend on your needs. And once again, this decision is so important because people, as soon as they make their decision one way or the other, don't realize necessarily that an earthquake has happened behind them. Now, if you decide later on, I don't like the path I'm on anymore, I want to switch to the other side. Well, you can't do so willy-nilly because you'll fall into the chasm. So you have to wait for a bridge to be open. But bridges like from the United States to Canada, to cross, you have to follow certain rules. Right? To cross from original Medicare with a Medigap policy to Medicare Advantage is really easy. Just call a phone number. The person on the other end of the line will be more than happy to sign you up and take a commission. Very easy. The problem is if you move to Medicare Advantage, if you started with Medicare Advantage and don't have a guaranteed issue right, if you move to Medicare Advantage during open enrollment, you may never be able to go back. So guaranteed issue right. You only have 6 and sometimes 12 months of guaranteed issue to get a Medigap policy. After that, you may never be able to get or change Medigap policies depending on your health and your state. Okay, that's why this is so important and why I've spent so much time trying to go over this during open enrollment. People go on Medigap policies and they start paying $200, $300 a month for a Medigap policy and don't have free dental. So they see the commercials with Joe saying $0 in monthly premiums with all these extra benefits. What am I paying for? I'm just going to call the number. And they sign up. The person on the other end of the line never has to talk to you about guaranteed issue right, never has to check your network or tell you about copays or prior authorization. You will find these things out on your own if and when you ever need extensive healthcare services. And at that time, going back will be difficult, if not impossible. Okay. So I'm going to skip this next one, but it's an interesting study if you ever want to go take a look at it, but I'm going to skip it. All right. So I'm happy with my plan. Why do I need to review it? I hear this a ton during open enrollment. My plan worked really well for me, Melinda. Why would I waste my time trying to make heads or tails of it and compare during open enrollment? Well, to put it frankly, this is why. Come March or April, you will start seeing news stories with this sort of message. Those awful drug companies, they keep gouging seniors. They're so unethical. I used to pay $5 for my medication. Now I pay $500. This is just wrong. Yeah, it's much, much more likely that she didn't review her drug coverage changes during open enrollment. If she had done that, she would have seen that maybe one of the medications she was taking would no longer be covered in the next year. So here's why reviewing your coverage is so important. You only have a 1-year contract with a Part D drug plan or a Medicare Advantage plan. 1 year. They will send you a document in the beginning of October, basically telling you all the changes that they're going to make for the next year. That is essentially your contract for next year. If you just throw it out and don't look at it, you're agreeing to it, whatever it says. And here's the deal. They can change everything about that coverage next year. They can change premiums, deductibles, out-of-pocket copays, spending limits. They can change the pharmacies in and out of network, providers in and out of network. They can change the medications they cover and don't cover. They can change and add prior authorization or step therapy to things that didn't have that before, all while keeping the same exact plan name. It can be entirely different coverage with the same plan name. That's why you check. And really, truly, insurance companies know only about 13% of Medicare beneficiaries actually review their coverage during open enrollment. So they're free to make changes however they want to behoove their bottom line. On average, for every year that you do not review your drug coverage or Medicare Advantage plan, studies have shown you will basically be overpaying by about $400 a year. So if you haven't reviewed your drug coverage or Medicare Advantage plan in let's say 5 years, you're likely to be overpaying by about $2,000 in the next year. This is a super fun fact. We do coverage reviews for our clients. Our company's current record is a woman who saved $235,000 by changing drug plans for 1 year. The very first review I did this year out of the gate, my client saved $15,000. Right now in this open enrollment season, our average client is saving more than $7,000. That's our average client. So what I need to tell you about why is it so high this year. In past years, it was maybe $2,000. It's because of the Inflation Reduction Act that came into place. The Inflation Reduction Act actually made significant changes to the Medicare Part D program. By 2025, the Inflation Reduction Act requires that the Part D beneficiaries, Part D plan members, the most they will pay out of pocket be $2,000 a year. Well, that sounds really great, right? Like $2,000 spending limit? What's wrong with that, Melinda? Yeah, I'm going to tell you what's wrong with this, because as you will see, my average savings right now is $7,000. So this is not good for some beneficiaries, but it takes a little bit of explanation. So in this year, Part D, the Part D drug plans had 4 payment stages. Everybody goes through 4 payment stages. Stage 1 is the deductible, basically up to $505. After you pay the deductible, then you move to the initial coverage stage. In the initial coverage stage, the insurance companies jump in to help cover the costs of medications. When the total out-of-pocket spending between you and the insurance company is more than $1,000, then you'd move to the coverage gap. The coverage gap, you have 75% discounts on the retail price of medications, but you still pay 25%. When you're spending all in through all 3 stages, hits about $7,400, then you move to the catastrophic coverage phase where you pay only 5%, where you pay only 5% of the prescription medications and things. Oops, wait, there we go. In 2024, for next year, to accommodate for what's coming in 2025, in 2024, the catastrophic coverage phase where people would pay 5% of the retail cost of medications disappears. So catastrophic, as soon as you're done with the coverage gap, about $7,400 all in between you, the discounts, and the insurance companies, you will pay nothing more. Then for 2025, the coverage gap disappears. So essentially then your drug costs will be capped at about $2,000 a year. But you'll notice that pill was divided equally into the amount of money that is spent in those different stages. You'll notice there's a very small portion of the pill that's actually remaining. So who's going to pick up the costs that just disappeared? Who's going to pay those? Because I guarantee you the medications are not just magically becoming free. So where do those go? All right, so who's going to pick up the costs of the medications in 2025? This is this year. So right now, seniors pay 5% in the catastrophic coverage. Medicare pays 80%, and Part D drug plans pay 15%. In 2025, when the coverage gap and catastrophic coverage go away, drug companies, or I'm sorry, not drug companies, Part D insurance companies will be required to go from spending 15% to 60% of that total amount. How many of you actually believe that the Part D insurance companies are just going to take a $4.6 billion hit? You think they're just going to take that laying down? No. So this is what's happening, and we're already seeing it. Part D insurance companies are going to pass on this cost. Plan premiums are increasing. So we've got a couple of plans that are dropping to nothing in monthly premiums, but that's a couple, and those are designed to take your eye off the ball because most plans are increasing in premiums by about 25% this year for this next year, 25%. They're also doing an increased cost sharing. So they used to, for example, have copays like 0 to 3. Those copays consistently across the board are now going to be $5 to $10. Little, but that adds up. Also, in tiers 3 and 4, if they charged a flat amount before, like $45, yeah, that's going to a coinsurance. So let's say your copay was $47. Now, with a 25% coinsurance, a medication like Eliquis with a retail cost of $550 is going to go from $47 per refill to $137.50 per refill. And then, of course, the single most important thing to know, they're going to drop medications from the plan altogether. So if the $2,000 spending limit only applies when your medications are covered by your drug plan. There's a whole bunch of medications out there that if you lose coverage on, you will pay $30,000 to $40,000 a month on. So the $2,000 spending limit only applies when your medications are covered, and they only have to cover a certain number of medications by category of medical need. So I've got about 7 minutes left. So I'm going to tell you, I'm going to kind of run down. I get people don't really want to review their coverage themselves. They don't know how, they don't know where, they don't know when. Get help. This is a list of places that you can get help from. Now, Medicare.gov has a plan finder tool. If you can order things on Amazon.com, trust me, you can use the Medicare.gov plan finder tool to review plans. Medicare insurance agents will also potentially help you, but please know if you go to a Medicare insurance agent, very likely they're only going to talk about the plans that they sell. Local pharmacies will often run comparisons for you, but they will only cover costs at they will only compare costs at their pharmacy. Last year, I saved a woman $7,000, not by changing drug plans, but by changing pharmacies. Changing pharmacies can be a big difference in cost. So just be aware of that. And SHIPs, sorry, I just changed the screen, but SHIPs are government entities, government-funded entities staffed by volunteers. Please, if you rely on a SHIP, know that you are working with a volunteer who has only so much training and experience. Be nice to them. And obviously, the quality of the guidance you get will vary a lot depending on which volunteer you get. And then there are places like ours, but we have to charge a fee for what we do because we don't sell insurance and we are not funded by the government. So we work for you, but unfortunately you have to pay a fee to us. We got to keep the lights on somehow. So those are the things. Choose what works, whatever works best for you. An open enrollment triage. How do you know if you really need to review your coverage? Well, quite frankly, has it been 2 or more years since you last reviewed your coverage? Yeah, you've got an urgent need. Has your health changed since you last reviewed your coverage? Yep, urgent need. Do you take even one brand name medication or 5 or more medications on a whole? Urgent need. And then, of course, if you've chosen drug coverage, the same as your spouse, because you thought it would be easier to manage it to just have the same plan, yeah, your need's critical. So 5 more minutes. I'm doing okay. I'm doing okay. Woo. So I hear this very often. Melinda, I don't really need to know this. I'm just going to go to an insurance agent and they'll help me. Yeah, maybe, maybe not. Unfortunately, the good ones and the bad ones don't wear name tags. It's really hard to tell the good ones from the bad ones. And unfortunately, there are bad ones out there. So this is what you need to know about insurance agents that sell Medicare. They make a lot more money selling Medicare Advantage plans than they do Medigap supplements. A lot more. In the initial commission that when they sell you a Medicare Advantage plan, they will make about 40% more selling you Medicare Advantage policy than they will selling you a supplement. That exacerbates over time. Over 20 years, let's say you buy a Medicare Advantage plan from an agent at the age of 65. If you live another 20 years, the Medicare insurance agent will make about $6,300 selling you Medicare Advantage and only about $2,000 selling you a Medigap policy, because Medigap policies stop paying renewal commissions after 6 years. Medicare Advantage plans never stop paying you renewals. So you tell me, if I'm an insurance agent, tell me what I want to sell you. So just beware, buyer beware. How do you qualify an insurance agent? Do you ask them, do you sell Medicare Advantage Part D and Medigap policies? Not all insurance agents have to sell all types. What is your sales ratio? What percentage of Medicare Advantage policies do you sell versus Medigap policies? If they sell 90% Medicare Advantage, yeah, you know. How many companies are you allowed to sell? Some insurance agents are captive. They only sell one insurance company. That's what they're going to show you. That's what they're going to sell you. Then pay attention to the conversation. If the sales conversation begins with an agent prioritizing discussions about $0 in monthly premiums and free dental and free gym membership, you might want to run the other way. If they talk about today only, hey, you know what? This is going to work great for you because you can always change later on. Insurance companies actually put this in their marketing materials. Yes, you can change to original Medicare Part A and Part B. That does not mean you will get a Medigap policy. It's a half truth. So if they only prioritize today, saying you can always change later on, run the other way. If they talk about networks and prior authorization and guaranteed issue rights and the whole conglomerate of how things work, that's good. That's a good insurance agent. So last thing to know, open enrollment is going on right now, October 15th through December 7th. Review your coverage. If you decide to make a plan change, that plan change will take effect January 1st. There you go. And that's me, JB.
Well, hopefully I am going to do this share correctly. And I believe people should see from information to action. Melinda always gets me excited and shows the intricacies of Medicare, which I find really interesting, that during your work years, there are no like alphabets and dissections of all the different parts of your healthcare coverage. You generally say, I have United Healthcare or Blue Cross or whoever you have, and you go and hand in the card, and all the details, all the rules don't get sectioned off in the way that they do with Medicare. So at the time when typically you're aging and you have the greatest cognitive load, that, well, now the cognitive load that you used to handle, you can't handle. So it's so troubling. But I see that all should see why I brought Melinda to try to educate us all. So at every presentation, we try to help you take the points of education and turn them into something. So I think she did a really great job of explaining, the insurance agent portion. They are consultants similar to how Envision works through financial planning. While you can implement some of the stuff with us, we start with planning. And if you never implement with us, that is your decision. But we want to establish a plan, and they are the ones to help establish a plan. So they've got several different consultations. What I will say is on the one slide that she showed, that you can get help through fiduciary financial advisors. Envision is a registered investment advisor. I'm personally a certified financial planner, which kind of has the highest fiduciary oath. So by working through us, because we do have a business relationship. So you thought she was just my friend. I got a business relationship with her too. So you'll get a discount off of what the pricing is on their website by working with us. So I thank her for giving you this direct information. We're just going to show you a few of the consultations possible. So this is like the personalized Medicare. There's one for expatriates. There's the Part D prescription review. There's something called the
MAPD.
Yes, so I like it because it says map. So what's the right map for you?
You left off the D.
Oh, sorry I messed up the D.
No, so it stands for, just so you know, this fun fact, MAPD stands for Medicare Advantage with Part D drug coverage. MAPD. There you go. Now you know.
Yes. Well, see, spell check apparently.
No. They would never catch that. No, they'd never catch that.
All right. Okay. So glad to have her to clarify. Then if you are finding yourself bumping it up close to or over the income-related Medicare surcharge, then that's another conversation. If you really don't know about that, that's something to at least understand. And also another shocker is depending upon especially if you're married, depending upon how the income works, one spouse could pass. And if the income doesn't go down, the next spouse could get hit with some extra nasty additions to their monthly costs because the price changed for single versus married, and it's based upon income. Then there's something that I'm going to have Melinda tell you a little bit more, because she spoke at a conference I was at, and I had no idea. Why don't you tell them about it?
So fun fact, if your adult children, or your parents, if any of the above all, have powers of attorney for each other, those won't work with Medicare or Social Security. So you can have powers of attorney all day long, but it won't allow you to talk with Medicare or Social Security on behalf of your loved one. In order to talk with Medicare, you must be a Medicare authorized representative. Medicare authorized representative. You can set that up through Medicare.gov. There's also a form. For Social Security, again, powers of attorney won't work. You have to be assigned as the designated representative payee. Designated representative payee. I know this is super fun. And you can set those up through a Social Security.gov account as well, or a form. But please know that to set these up sooner rather than later, because inevitably people figure out that powers of attorney don't work when they're in like an emergency situation, and Medicare goes, haha, sorry, can't talk to you, bye. So there you go.
You learn something every day. So, and you thought that you had all those powers of attorney. And unfortunately, again, like it all worked until it didn't. So, often that's how it is in life. and some of the stories that are awful with people getting, hit with what that $235,000 case. She had told me another one that was 100,000 that blew my mind the first time I ever heard Melinda speak. So, often people just haven't had this hit, and maybe when you're 66, 67, hey, you're early on, still healthy, but time goes on. I know that my mom's 95, and I think she's been in the hospital 3 times this year, something like that. So, suddenly things are happening. So when you don't have the right plan for you, then, and you didn't know there was the right plan because you didn't know what your exposure was. So to request the, a Medicare consultation to get our pricing, you should email our OPS at envisionwealth.us so we can get you in the system and have you set up with Melinda. She can even guide you to the right consultation for you, but you have to go through us in order to get the preferred pricing. And then if you want a copy of that power of attorney form that we just showed you to streamline it, we're not going to charge you for that. So just come to us and we can forward that on to you. Clearly all this devil's in the details and all of this stuff. So thank you for going through all the specifics as well as changes that are coming, because you kind of wouldn't know until you start to say, hey, this used to only cost this, or they used to take this, and suddenly you find out. So that's why I think now during this period, is a great time to get yourself set up right for 2024.
James,
thoughts, Melinda, or questions from?
Yeah, are there any questions at all? JD, are there any questions?
Melinda, I think you did such a fantastic job. We have nothing in the Q&A.
Come on.
Wonderful attendee.
So let me do this. JD or JB, do you have any questions? I know JB's already asked me all the questions he has because he has free reign. I never know.
Well, I just think, maybe just summarizing again, like the whole spending limit issue, one plan to another. Oh,
so the spending limit. All right. So if we're trying to make a plan and really keep costs under control on Medicare, I'll bottom line it for you. It's very predictable on the path of original Medicare with a Medigap policy. Plan G is good. Plan G for good. So you have original Medicare with a Medigap policy, Plan G. You're paying monthly premiums for Part B, the Medigap Plan G, the drug plan. After you've paid those monthly premiums, you have few, if any, additional out-of-pocket costs for healthcare services. Literally, you could be in the hospital 3.5 weeks after having a terrible car accident and not see another bill. That's a very budgeted, predictable approach to healthcare expenses. Medicare Advantage, you have nothing to budget you have $174.70 for the Part B premium, but there's no cost typically for Medicare Advantage policies themselves. But bring your wallet to every hospitalization, every doctor visit, every lab, every specialist visit, because you are going to pay as you go. Ta-ching, 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 up to the plan's out-of-pocket spending limit. And again, those spending limits can be as high as $88.50 in 2024 in network, or $13,300 in and out of network in 2024. That's not chump change. Again, that can be quite a pretty penny. So be aware of the spending limits, and then be aware too that the spending limits only apply when you are following the rules. If you're not getting prior authorization, you're going out of network when it's not allowed, you pay everything 100%.
Well, that made me think. So, every year my mom gets this, Frank, and it says it's the Medicare handbook, but I've been making, light of saying, well, the handbook's nice, but it's not the rule book. So,
true.
So in a lot of the cases that are the horror cases that, I've heard of, it's the rule book and it's not the handbook. So don't, but by the way, my mom's 95. I'm not quite eligible for all this Medicare, but she's not going to read this.
Nobody is.
Nobody. And that's just the handbook.
And it's 127 pages. 127 pages, JB.
Well, there's some nice tables and some pictures of people, though. So anyway, again, Melinda, I am so thrilled that you could find time in your schedule to help our clients and any prospects that choose to watch this, learn more about, making sure you don't need to get and be part of the negative stories that Melinda hears about and adds to her presentation. And hopefully you can pass some of this information on to friends and families who hopefully haven't made their decisions yet for this year. And they can reach out and see if there's just a more optimal decision for them to make.
Awesome. Thank you so much. Thank you.
All right, JD, are you going to close us out?
Thank you all for attending. Once again, this is our monthly webinar series, Envision Money Making Sense. And we do this every month, usually the last Thursday of the month. However, due to upcoming, this little thing called Thanksgiving and then Christmas, our November and December webinars are going to be around the 15th of the month. November 16th is our next one, so please be on the lookout for information about that. And once again, you should be receiving recording things for those who have registered. And if you did not register, but you did want to pass this recording on to somebody, should be going up on the envision.us website very soon.
Hey, there's a question that I noticed that came in just came in. So how is the Medicare power of attorney role different from being a regular power of attorney? I'll try to take that quick. So there's two basic power of attorneys, one's financial and one's for healthcare. In the case that you would need to help somebody that has something to do with Medicare, you need, or Social Security, we learned today, that you need to go and have these documents. So you can handle other elements, but if it's specific to Medicare, they need their own power of attorney for you to answer. The other power of attorney will not rule over it. It's a bit like a beneficiary designation on an insurance policy overrules what someone might put in a will. Like, people think wills work, but like sometimes there's a specific, and in this case, the specifics of Medicare require you to have their power of attorney form. They're not going to listen that you have either the financial or the healthcare power of attorney to answer their questions.
Well said. Nice.
Thank you. All right. And that will be it.
Thank you so much, everyone.
All right. Thank you.